everyone, this is a presentation to accompany the components of your lesson here in your course. This particular presentation will focus on chapters 13, which is the endocrine and lymphatic structures, and chapter 14, which is the integumentary system. This presentation is not a substitute for reading the textbook chapter, so please make sure that you are doing the reading also. This is a supplement. So if we start with chapter 13, your textbook authors first go through some of the structures of that particular system, the various organs that are included in the endocrine system. They provide a graphical picture for you on figure 13.1, and this is a very similar photograph here. It's noted from a coding standpoint that some of the organs of the endocrine system are located or coded to a different area of the coding system, such as the ovaries go to the female reproductive, the testes go to the male reproductive, as an example. One thing I wanted to point out that we've had a previous exercise as one of your earlier graded assignments about this carotid body. It's here again in this particular chapter, so I want to make sure that we are understanding what is being referred to as a carotid body, and it's located in this component. Typically, you should think of it as outside of the carotid artery. It's not inside the artery. It's a small structure located at this junction of the patient's common carotid artery. From a coding standpoint, we have the knowledge, hopefully, now that we would index the actual word carotid body as our anatomical structure, and we're given that particular piece of anatomy if this is what is being addressed. For the endocrine system, common root operations include excision and resection. So again, as an example, if a patient is having a right thyroid lobe biopsy, that would be equated to the root operation of excision, because a biopsy by definition is taking out a small piece of a body part. And anatomically also, the right and left thyroid lobes are considered two distinct body parts in ICD-10 PCS. So another example, if a patient had their entire left thyroid lobe removed due to a mass or surgery or cancer, the removal of the entire left thyroid lobe would equate to resection, because that lobe is considered one distinct body part. So it's important that you are understanding the difference between excision and resection, because those are two of the most common root operations that relate to the organs of this particular system. For surgical approaches, the most common surgical approaches are open percutaneous and percutaneous endoscopic. You may also see the surgical approach of external, when the removal of a device or revision of a device that is being put into an endocrine organ, or it has been put into an endocrine organ or gland, is being worked on. Then if we move to the lymphatic system, again from an anatomical standpoint, the lymphatic system includes lymph vessels, lymph nodes, tonsils, spleen, and the thalamus. Our ICD-10 PCS coding classification addresses the tonsils in the mouth and the throat body system. Functions of the lymphatic system are to return lymph to the venous system and take fluids away from cells. The lymph system also provides a defense mechanism. Lymph is similar in consistency to blood plasma. Structurally, lymph nodes are small oval organs and they act as filters. In terms of your thymus gland, the thymus gland is found in the mid-chest, anterior to the ascending aorta, and the posterior to the sternum in most people. The spleen is structured like a very large lymph node. Filters blood in a similar way. The spleen is located just below the stomach. And in addition, this particular area of your textbook also talks about bone marrow. Bone marrow is spongy tissue inside some of your large bones. It contains immature cells called stem cells. Stem cells can develop into the red blood cells that carry oxygen through the body, the white blood cells that fight infections, and platelets that help with bone clotting. In terms of a coding tip in your textbook, they talk about the difference between the excision or the removal of a lymph node chain and a lymph node or nodes. So for example, if a patient is having a lymph node biopsy, even if it's multiple lymph nodes, the root operation would be excision, because typically they're checking to see if the patient has cancer or the cancer has spread, or they're looking for Hodgkin's lymphoma, which is a type of cancer. But in order for us to code resection, we have to have more than just pieces removed. And because the lymph structures are very small and they are multiple structures, in order for us to code resection, an entire lymph node chain has to be removed. Level is another word that the physician may use. He may say lymph node level, and level and chain are synonymous. One coding tip I wanted to provide you that's not in your textbook specifically talks about transplants. In this area of your textbook chapter, it talks about autologous or non-autologous bone marrow specifically. Auto, A-U-T-O, it relates to self. So if we talk about something that's autologous, meaning it's someone self-donating to themselves. So in the case of bone marrow, they had it removed previously, and now today they're coming to put it back in, or we're coding the initial removal. It also talks about your textbook about bone marrow biopsies. Bone marrow biopsies are not coded to the root operation of excision. They are coded to the root operation of extraction, because they're actually pulling out or stripping out the bone marrow. That is also noted for you in your textbook. So make sure you understand what's going on in terms of a bone marrow operation, a bone marrow biopsy. Common root operations for this lymphatic system include dilation, occlusion, restriction, excision, and resection. Again, don't forget, when we are coding your biopsy procedures, that your last qualifier value should be X, because biopsy by definition is looking for diagnostic confirmation, or is being done for analysis, or some other way to think of it, that this is a fishing expedition. The surgeon is doing this component of the procedure, this biopsy, to get information on diagnosis. Surgical approaches for your lymphatic system and lymphatic structures typically are open percutaneous or percutaneous endoscopic, any one of them. You can see external approach used, again, if it's a device factor. The physician has a device that's in a lymphatic structure and is working on changing the device, removing it, or reviving it, then you could possibly, based on the documentation, use the external surgical approach related to a lymphatic body part. Often, there's many lymph nodes. If we go back to that picture, these are just some, this is just really almost a little more than half of the body. You have also lymph nodes in the lower half of your body. So, anatomically, if the physician refers to it by name, and you don't know where that lymph node is location-wise, and it's not listed specifically as it's documented on the table or in the index, and you need to look at your body part key. In the back part of your ICD-10 PCS coding manual, you have appendices. You have appendix A, B, C, D and E, I believe it goes up to E. Appendix D is a body part key. It does have a lot of lymph nodes on there to help you understand or be able to identify where you would code that to. So on the left side of this picture here, or this screen, you have the terminology that you might see, such as brachial lymph node. If you don't know where that is, it's lymphatic right axillary in terms of a coding choice when you get to the coding table or when you're in the alpha index. She talks also in your textbook about perirenal and periadrenal are coded to the aortic nodes, meaning these are the ones around the kidneys or around the adrenal glands. Also, as another reminder, because we do have some of this in terms of bone marrow and transplants and things, remember your definitions of allogenic, synergenic, and zeoplastic. We had this earlier back in chapter 3 or 4, I believe. But allogenic, just as a reminder, is someone who's human who's donating to another human. So it could be a family member, it could be a total stranger donating to another person, human to human donation. A synergetic transplant is a twin. It has to be a twin as in sibling. And then zeoplastic is tissue from an animal to a human. Typically it's pig or bovine to human. Before we move into the integumentary system, just remember that you have a separate presentation focused on the chapter exercises at the end of chapter 13. So moving into the integumentary system, which is chapter 14 of the textbook, remember the organs of this particular system is the skin and breast tissue, the major organs of the integumentary. Ancillary structures include hair, nails, subcutaneous tissue, and fascia. For this particular coding system of ICD-10 PCS, skin is composed of the epidermis and the dermis. Reminder of definition: subcutaneous tissue is below the dermis and is composed of connective tissue, also called subcutaneous fat. Fascia, by definition, is connective tissue that surrounds muscles, groups of muscles, blood vessels, and nerves. Breast tissue can also be referred to as mammary gland. You can be found in both males and females, so procedures could be done on males and females depending on what's going on. Also, as an accessory organ of this system is the nails of your fingers and toes. Anatomically, there's a picture in your textbook. The portion of your nail that you can see is referred to as the nail body or the nail plate. The nail root is under the skin. But from an ICD-10 PCS standpoint, there's no difference or there's no distinction in terms of a body part value between a nail bed or a nail plate or a nail root. The only distinction is a fingernail or a toenail. If the physician is working on what he calls a nail fold, then that would be coded to skin and not to nail itself. Common root operations for this particular arena include liposuction, because we're talking about skin. So there's a coding tip here. Liposuction is performed if it's performed for a clinical reason. So the patient is donating their tissue to be used later, for example, for a graft. Then in that case, it's a clinical reason. They're not getting liposuction for a cosmetic reason. Therefore, it is the root operation of extraction, because they're taking that tissue out and they're going to be using it later, maybe for some type of reconstruction. after a major extensive surgery. If it's being done for a cosmetic reason, if the liposuction is being done for a cosmetic reason, then the root operation is alteration. The other root operation that's very common related to skin is grafting, skin grafting. So you have to understand what that means. There's different kinds of skin graft. In your textbook, they specifically mention a free skin graft. And a free skin graft, basically they're taking skin from typically one area of the patient, maybe their back, and they're putting it somewhere else. They're putting it on their arm, they're putting it on their face. They have to remove that entire piece of skin that they're taking from the patient's back and move it to another location. Another type of graft, in a sense, is a flap. But be careful with the word flap from a documentation standpoint. A flap means something's going to be flapped over in terms of coding. You have to flap it or move it right next to where it's coming from. So your donation is right next to your defect, your surgical defect or your anatomical defect. You're literally flapping this new skin or the healthy skin over. Part of it is still connected to the source it came from. When we talk, however, about tram flap, which is a procedure that's done for a patient who has had a mastectomy and is having a reconstruction, the word tram flap is often used, but however, it's not really a flap because they're taking either abdominal muscle and moving it to the breast, or they're taking trunk muscle. So in those cases, we have to think about that differently in terms of our root operation, because it's not a flap. They're not flapping tissue from the abdominal up to the breast. They're actually cutting it off. It's like a free movement of donation, of moving new tissue to a new area. They also continue to talk about mastectomies in your textbook. If a patient has a mastectomy and during that same operative session they do an immediate reconstruction, then we code the reconstruction or replacement. We do not code the resection of the breast. But if a woman has, or a woman or a man, but if a woman typically has a major mastectomy and they don't do the reconstruction right away, we would code obviously resection. Another procedure specifically talked about is plantar fasciotomy. Remember your medical terminology, the word otomy. It ends up related to the root operation of division, cutting into. And typically this particular procedure is done via endoscope, but it can be done a different way. And of course, all of it is dependent on your clinical documentation. Devices. In general, in coding, in this coding system, ICD-10 PCS, for tissue to be considered a device, which it can be, it has to be disconnected from its source. So for those flaps, those wouldn't be considered devices, the tissue flaps, because you're flapping it over from it, it's still connected. A free graft, a free skin graft, however, as they talk about, could be considered a device, and that could be reflected as a positive value in the device character value of your ICD-10 PCS coding table. We also have something that's more characteristic of a real device, a 3D, something you could hold in your hand outside of the patient's body before it's put in the patient's body. We have these things called implantable devices, which are probably going to be coded in the integumentary system, the insertion of them, because they're typically put in the subcutaneous level. Those can be things like capsules, generators, ports, pumps, and reservoirs. Coding tip number 7 here is guideline B4.6. If a patient is having some work done on the skin or the subcutaneous or the facial level of their body, but it's over a joint. Let's say they have a lesion of the wrist. They give you direction on body part values, basically. So if a patient's having work done on the skin of their shoulder, that equates to the upper arm, for example. If a patient is having subcutaneous tissue addressed of their wrist, lower arm. If it's subcutaneous tissue of their hip, it's upper leg. Additionally, guideline B3.5 is noted. If a patient is having a muscle biopsy, and the physician codes that he went through the skin, he went down to the subcutaneous, and he went to the muscle. You're going to code to the deepest layer, in that case, the muscle. So if the physician has to go through multiple layers to get to the final skin or subcutaneous or tissue, whatever level he gets to, you code to the deepest layer. You wouldn't code an excision of skin, or excision of subcutaneous tissue if the end result was getting to the fascia. Surgical approaches related to skin and integumentary, of course, include external, which is working on the top of the skin. And open would be incision, going into the skin. Another coding tip has to do with an epidermal autograft. We have something called a tissue cultured epidermal autograft. Auto is important because this patient is donating to themselves. Typically, they harvest some of their skin and they grow it in a lab and they make it more like a sheet. They make it bigger. They add cultures to it and they make it grow. Then the patient comes back however many days later, and they use that skin that they have grown and fostered in the lab to do a skin graft. I also wanted to give you some pictures of the devices we were talking about earlier so that you understand the difference. Sometimes there's confusion between what's a port and what's a pump. These are ports. They typically have a very small area that can hold something such as medication. This is an insulin pump. Just to give you an illustration. Then we can also implant, patients can have spinal and brain stimulators planted in various subcutaneous levels. So these are examples, graphical pictures of a peritoneal nerve stimulator, cervical spine, an intrathecal drug pump, etc. For the integumentary system, you have a lot of options at times for your qualifier character value. You won't always see just Z as no qualifier. So it depends on what you're coding, obviously. Table 14.3 gives you some idea what those possible qualifiers could be. Depends on the table again. Sometimes it will be related to the grafting that you're coding. So 4 could be a possible option for partial thickness, such as their epidermal cultured graft. Patients having a tram flap could be 6 on the qualifier value, but again, don't try to memorize your qualifier values. The idea is that you understand that unlike other body systems, your qualifier values will change in this particular body system because you have options. And those options will be depending on what your table you're at and what row you're at. And all that goes back to what you're coding, such as a flap, a graft, etc. So that is the conclusion of your presentation. Again, your exercises for chapter 14 is in a separate presentation. If you have any questions on this presentation, you can inbox me in Canvas or post to the related discussion area in the lesson. Thanks.